This is Dr.RED Panda.
What's the use of a man's chest? Can a man's chest produce milk? Can men also get breast diseases? I'm Dr. Red Panda. In this video, let's dive into these questions. If there's anything useless in this world, a man's chest surely makes the list. Every month, tens of thousands of people ask on Google, why do men have chests? While women's chests bear the crucial responsibility of nurturing and birthing children, men's chests seem superfluous. What's more frustrating is that some men's chests are even larger than women's. Why do men even have chests? As for men's chests, there are plenty of theories flying around the internet. Some suggest that men have chests for the sole purpose of differentiating the front from the back. Others jokingly propose that men's chests are there for hanging capes. So what's the real deal? To understand this, we have to spin back the clock to when we were just fertilized eggs. Once Mr. Sperm and Miss Egg fall in love and unite, only 3 to 4 weeks are needed for the chest to start forming, leading the routine. It's not until 5 to 6 weeks later that the sexual organs distinguishing males and females make an appearance. This implies that, initially, the evolution of the chest doesn't discriminate between genders. Until puberty, there isn't much difference between boys' and girls' chests since both are undeveloped. However, once puberty kicks in, the differences quickly become evident. Women's breasts not only increase in size but also gain the ability to nurse. This is because the ovaries in pubescent girls start to secrete estrogen and progesterone. Under the influence of these sex hormones, the breasts, mammary ducts, and lobules gradually develop and mature, preparing for milk secretion. When a woman becomes pregnant, the level of hormones in her body reaches a relatively high level, and the suckling of the baby stimulates the glandular cells in the breast to secrete milk. Men, on the other hand, are different. Although their internal structure is similar to women's, men's bodies primarily secrete androgens, which do not stimulate breast development. Moreover, men do not have the need for nursing, so their chest remains in a sort of standby mode. All in all, whether from a physiological or societal need perspective, a man's chest is often just there for show. Why do some men have bigger chests than women? It's not uncommon to hear some female friends complain that their boyfriends have bigger chests than they do. Actually, there are 3 primary reasons why men might develop larger chests. Firstly, for those who enjoy working out, it's entirely possible to build up a big chest through exercise, so that should come as no surprise. Secondly, excessive obesity can lead to fat accumulation, which visibly increases chest size. However, if a man is neither overweight nor a fitness enthusiast but still has a full chest, it may be cause for concern. This could likely be a sign of excessive breast tissue development. Medically known as gynecomastia, it generally results from an imbalance of hormones within the male body, leading to abnormal development of breast tissue. In simpler terms, it's when there's not enough androgen to counteract estrogen's influence effectively. The various functions of male chests. Firstly, let's talk about men's chest muscles. Many people see them as a symbol of high testosterone. When encountering a strong man, even the most composed woman can't resist touching them. But men's chest muscles are more than just decorative. They include the pectoralis major and pectoralis minor. The pectoralis major primarily controls shoulder joint movement by adducting and rotating the arm, meaning actions like swinging the arms rely heavily on this muscle. The pectoralis minor assists in adjusting shoulder position by aiding scapular movement. Whether it's a loving hug or lifting weights, the pectoralis minor plays a crucial role. However, although everyone has chest muscles, aesthetically pleasing ones are rare. In the quest for a fuller chest, modern men are flocking to the gym. Secondly, in romantic relationships, a man's chest is also a sensitive area. Similar to women, the sensitivity of the male chest rivals that of genitalia. This is because the nipples are rich in nerves associated with hair follicles. When stimulated, these nerves interact with nearby muscle tissue, creating intense sensations akin to electrical currents. Thirdly, there's a curious theory about the role of male chests. When ancient men were bare-chested, their nipple areas might have served as a warning signal, akin to the false eyes on butterfly wings, constantly alerting them to the approach of wild animals. While this theory may have merit, nipples alone might not be very intimidating to animals. However, considering that early humans might have practiced body painting, combining fierce patterns with prominent nipples could have been an effective way to deter animals. Lastly, in CPR, cardiopulmonary resuscitation, medical practitioners locate the center point just below the line connecting the two nipples. This precise position aids in more accurate chest compressions. Men can also lactate. Don't ever think that breast tissue is exclusive to women. In fact, men also have breast tissue similar to women. Men have mammary ducts and, in rare cases, mammary lobules. They are typically underdeveloped and dormant, but they are indeed capable of lactating. Men also have a hormone called prolactin, synthesized by the pituitary gland, which promotes milk secretion in the body. Prolactin produced in men is usually broken down by the liver before it can exert its lactation effect. However, if the liver is damaged or if there are issues with pituitary or thyroid function, it can lead to elevated levels of prolactin in men, potentially resulting in lactation. Numerous accounts suggest that men can lactate. For example, the renowned physiologist, DR.RED, recorded such an incident in his book, Why is Sex Fun? He documented 500 cases of spontaneous male lactation among survivors of Japanese prisoner of war camps after World War II. Similar instances were reported in Nazi concentration camps. Conditions in these camps were extremely harsh, with survivors' bodies severely compromised, each person emaciated from starvation. When rescued and provided with adequate nutrition, bodily functions gradually began to recover, but not synchronously. Pituitary function recovered before liver function, causing the produced prolactin to remain unprocessed by the liver, leading to lactation in some male survivors of the camps. The dad who desires to lactate. In 2009, a Swedish economics student named Ragnar from Stockholm University had an unconventional idea. Inspired by the desire to strengthen the bond between himself and his 2-year-old son, he embarked on a personal mission to produce breast milk. Ragnar's unconventional approach involved using a breast pump to stimulate his chest daily, even during his classes. Experts suggested that this bizarre stimulation method could potentially lead to the production of 1 to 2 drops of breast milk within 3 to 4 months. Male breast cancer, a disease not to be ignored. Male and female breasts share the same structure capable of producing milk, which means that diseases affecting the breasts are not exclusive to females, with male breast cancer being one of them. Although this is a rare disease, occurring in only 300 out of every 100,000 males, vigilance should not be relaxed. Currently, the exact causes of male breast cancer are not fully determined, but known triggering factors include familial inheritance, elevated estrogen levels, and chromosomal abnormalities. Compared to female breast cancer, male breast cancer patients tend to be older, typically diagnosed between the ages of 50 and 59. Their duration of illness is also longer than that of female breast cancer patients. Additionally, their survival rates within 5 to 10 years after discharge are lower than those of females. Many private factors contribute to this scenario. For instance, many male patients lack awareness of breast cancer and neglect its significance. The breast enlargement caused by the disease may also discourage them from seeking medical attention due to embarrassment, ultimately leading them to miss the optimal treatment window, which is indeed regrettable. Breast cancer is not something to fear or be ashamed of, and overthinking won't help. The best approach is to seek medical attention early. Self-testing for breast cancer is simple. Press around the nipple area, feel for any lumps in the breast, and check for any discharge. If any symptoms are present, it's crucial to promptly seek medical advice. Patients with a history of breast hyperplasia should undergo regular breast ultrasound examinations. If a local mass is found during the examination, a pathological biopsy can provide a definitive diagnosis. Subsequent tumor removal surgery can yield favorable results. In addition to being vigilant about the risks of breast cancer, everyday breast health issues also deserve attention. During exercise, Men can wear specialized bras designed for males to prevent heat rash and sports-related injuries. Many prestigious European football teams and athletes use male sports bras during training. For example, Zlatan Ibrahimovic has worn a sports bra named GP Sports during training. While men wearing bras may seem unusual, these bras are legitimate and technologically advanced products that protect the chest during physical activities. They also use satellite positioning to monitor athletes' running distances, routes, and heart rate changes in real time, helping coaches understand players' physical conditions and adjust training promptly. Furthermore, on marathon tracks, we often see athletes running tens of kilometers, their nipples chafed by clothing, sometimes resulting in too long bloodstains on their shirts. Seeing them continue running, I can't help but feel anxious for them. If they had worn male sports bras beforehand, they could have avoided nipple chafing. Cultural symbolism of the male chest. Our bodies constantly follow biological principles without assigning special meanings to their functions. Cultural interpretations, however, are another story. For instance, a knee is merely a joint between the thigh and lower leg, yet kneeling has come to represent submission or surrender. Yet, from a cultural and social standpoint, the male chest is not without significance. In many cultures, a robust chest is seen as a symbol of strength, masculinity, and courage, conveying a man's ability to shoulder responsibilities for his family and society. For example, in ancient Greek and Roman cultures, statues of male nudes often feature well-developed pectoral muscles as an homage to heroic ideals. And that's a wrap for this episode of the video. I'm Dr. Red Panda. If any of you have your own perspectives, or if you think there are any errors in the video, feel free to leave a comment in the discussion section. If you found this video helpful, don't forget to subscribe and give it a thumbs up. Until next time, take care.